So as you know, on January 30th, the World Health Organization declared a public health emergency of international concern around the 2019 COVID because of the spread of the virus outside of China, describing it as an unprecedented outbreak. I would say that we are in exceptional times right now, and on March 11th, to nobody's surprise, the World Health Organization declared it a global pandemic. So if nobody has seen these maps, this is actually from the Johns Hopkins coronavirus kind of resource page. It's excellent. The World Health Organization has a similar map, and you can look at where all the hotspots are by individual countries. You click on them and it tells you what's going on in terms of cases reported, deaths, and cases recovered. So when we look at what's been happening, the orange line on this graph, you can see the axis is based on thousands or hundreds of thousands, and on the lower axis it's based on time. The orange plot is for mainland China, and the yellow plot is for other locations outside of mainland China. And the important thing to look at or note in this graph is that on March 15th, I believe it was, the number of cases outside of China exceeded the number of cases inside China. When you look at the countries and how they're affected, this was actually data that I took off at 11 o'clock from the Johns Hopkins site, but the World Health Organization has the same thing. You can see that in Canada, there's now 657 cases reported. I bet you there's more than that since 11 o'clock this morning. We've had 8 deaths, most of which are in BC out of the nursing home, and there are a small number that have recovered. So we're really at the start of this. There was something I heard on the news, I don't know if it's true or not, but it was saying that the rate of rise in the United States, because of their delayed response, is probably going to exceed what was going on in Italy, which is very concerning. 159 countries or territories around the world are reporting active cases. In terms of the pathogenesis of infection, this is a coronavirus. It's similar to SARS. It enters cells using the same doorway that SARS did, and that's through the angiotensin converting enzyme 2 receptor. Target site is primarily respiratory tract, so upper and lower respiratory tract. There is a study from Germany that's in press that we were reviewing that identified no viremia. So it really goes along with why it's not being found in amniotic fluid, not in urine, not in feces, not in breast milk. Range of incubation seems to be quite long, but the approximation is somewhere between 5 and 8 days. In terms of the origins, there's a number of samples from around the world studied. The genetics are pretty consistent, so that this is a relatively recent virus. It's thought that probably the first one started sometime at the end of October or in November. It's a mammalian coronavirus. The genome is it's 96% identical to bat coronavirus. It's not from snakes. There's a question about actually whether it came from a pangolin that was at this market in Wuhan. Transmission is primarily large droplet spread, so similar to influenza. So it's not specifically breathing it in. It's somebody coughing, the droplets landing on a surface. You touch it, you touch your face, you self-inoculate yourself. There seems to be, or the suggestion is that there's minimal symptomatic viral shedding. Sorry, there's minimal viral shedding before somebody is symptomatic, though there's a lot of question about that right now. Some suggest about possible fomite transmission data, and again, it's limited to respiratory droplets as opposed to viremia. The basic reproductive number, you'll hear this talked about all the time, the RO number, which basically says if you have one person who has it, 2 to 3 people are going to get it or at risk of getting it. If the number is less than 1, it means that there's a reduction in the number of people who are actually getting it. So this is a fairly infectious virus. In terms of the spread of it, it's, again, primarily from the nasal and the throat shedding, more from the nasal secretions, it seems, than from the throat. There is, I was just on another teleconference, and the suggestion was that it actually may be around when you aren't symptomatic for upwards of a couple of weeks. But that's actually looking at PCR data. So that's looking at RNA. There's some recent viral data out of Germany suggesting that probably 8 days after you first become symptomatic, you don't have any active virus yet, but you'll still have the RNA. So the screening test using the standard that we're using is suggesting that it's around longer than it might actually be active. So there's clearly data that's coming as we speak. Symptoms primarily starts with a cough or kind of a tickle in your throat. Obviously, the shortness of breath, difficulty breathing is the classical one, as is fever. The data from China, greater than 80% actually had mild disease. About 13–14% had severe, 5% had critical, and their case fatality rate was estimated at 2.3%. Again, part of the problem is difficulty with the denominator in terms of people who are either very mildly symptomatic or not accessing healthcare. So it's not entirely known, but if you look at places like Italy as an example, it seems like the case fatality rate is significantly higher. Why might this be? It's speculated that because of the age of their population, it might have contributed to it, because the majority of people, when you look at the deaths, if you look at the age group, certainly it's in those in their above 60 years old. Certainly as you get older, your risk goes up. And for women who are of reproductive age, you can see that the case fatality rate is actually quite low. In terms of the people who died from it, it certainly looks like it's an association with having other medical comorbidities. So typically cardiovascular, diabetes, respiratory disease, hypertension. There were certainly people who died who didn't have it, but they were in the vast minority of the deaths. So in summary, cases have been overwhelmingly seen in China up until a couple of days ago, and now there's more outside of China than inside of China. It's an easily transmitted virus, but not a highly transmissible one. Disease is a respiratory one with severe illness requiring hospitalization, and about 10 to 15%, most of whom are elderly. I say the case fatality rate seems to be quite low, but again, the data in some countries suggests it's quite a bit higher. Because this is not thought to be spread by droplets flying around in the air, the recommendation in most places is not wearing a mask. In certain circumstances, people who are wearing masks out in public places obviously don't understand the illness, and there's clearly a lot of fear that's going on right now. In a case, if a case is suspected, there are certainly procedures in every one of your centers that will be, identified, ways to follow, where they should be screened, and what they should be do when they come into the hospital. So I'm going to end it there.